If you provide CPR to patients, you need to listen to this video. In this short video, I'll teach you how to go from a good advanced life support team leader to an excellent one. If this video has helped you, please like the video and follow for more. When a patient's heart stops, CPR is commenced in 2-minute cycles of 30 chest compressions to 2 breaths. Whilst the rest of your team is providing CPR to the patient, your job as a team leader is to use these 2 minutes to consider the reversible causes of cardiac arrest using the 4 H's and 4 T's. Now, I want you to add 2 extra steps to your thought process before jumping to the 4 H's and 4 T's. The first thing to consider is place. You need to make a conscious decision whether you want to stay and play or scoop and run. Observe if the place that you found your patient in is a place where you can provide good quality, ongoing resuscitation and care to the patient. For example, if a patient has been found collapsed in a small bathroom, there is not much space for the team to get in, much less fit a crash trolley in. Or maybe the patient has been found in the corner of the room against a wall. Your team will not be able to access one side of the patient and also will not have space to manage the patient's airway. I've attended crash calls where the patient has been found in the middle of the hospital restaurant, where there's no crash trolley and no oxygen points. In these circumstances, the conditions are not optimized for you and your team to provide good quality care to the patient. Your team is going to be limited, you're going to run out of resources, and don't forget, resuscitating a patient in public, such as the corridor or the restaurant, is not dignified for the patient. As a team leader, you need to be thinking one step ahead. In these cases, I'll be thinking of scooping and running. I will be allocating a nurse or a porter to get a trolley. The moment the trolley arrives, it is a team effort to haul the patient from the floor onto the trolley. And then we're sprinting to the next place of safety, be it the closest ward, A&E resus area, or the anesthetic theatres. Once you've considered this, then we move on to the second step of the flow chart, which is drugs and defib. Here, I'll be thinking what drugs need to be given after this current 2-minute cycle of CPR. This could be amiodarone, adrenaline, calcium gluconate, or any other drugs. I'll be allocating a team member to get this drug out of the trolley to be prepared to give to the patient after this cycle of CPR. That way, there is no delay in the delivery of important drugs. Defib is a reminder to increase the defibrillation energy after each unsuccessful shot. And this goes on from 200 joules to 300 joules to 360 joules, and then it stays at 360 joules thereafter. Then we come to the last step, which is a consideration of the reversible causes using the 4 H's and 4 T's. I'll cover details of the 4 H's and 4 T's and my tips and tricks for them in my next video. Now, in this 3-step process, the first 2 steps should only take you 10 to 15 seconds to consider, leaving ample time for you to consider the reversible causes. This 3-step system has gotten me out of several hairy situations in the past, and I'll guarantee it will help you and your patients in the future. If you found this video helpful, please like it and share it with your colleagues so that all patients can receive good quality care. I hope that helps.